Hi there, and welcome back to My Blooming Health. It's Wednesday, so we have more health knowledge for you to help you bloom your way to better health. This episode is in regards to you now. You've purchased your health insurance. Now, what are your next steps? So I am here to help you get through the wonderful experience of now having health insurance. It's exciting. First things first, in another episode we talk about copays and deductibles. I want you to go back and review that one as well so that you have a better understanding as to how your copays and deductibles will work. That is extremely important, and if you're not familiar with having health insurance, you're not quite sure how that works. And we want to make sure that you're not digging yourself into a financial hole now that you have health insurance. Choosing a doctor. So we're going to talk about three topics here. Choosing a doctor is number one, choosing a hospital number two, and then outpatient testing. So let's first talk about choosing a doctor. Now that you have health insurance, use the website for that insurance company and look in your area by your zip code and determine what physicians are in your area. What you need for your everyday, day-to-day concerns, your back pain, your stomach pain, your typical issues that you need addressed is by an internal medicine doctor. That's who you want to look for your primary care physician. They're either internal medicine board certified or they're family medicine board certified. And that's who you want to look for in your area, closest to your home. And we also talked about in other episodes where you can choose a physician based on their rating at health grades when you're Googling your doctor to make sure that if there are any ratings, you want to know what other people like you are saying about these physicians. It is extremely important, word of mouth, to know how other people have been treated by these physicians in the past. In addition, once you find your physician, you want to make an appointment. Make your initial appointment. Have your doctor establish a baseline as to who you are and how your current health condition is. So what you want to do is you have your first physical with your physician. That way you can get your lab work done, maybe x-rays if necessary. And no, you may not have issues at this time, but again, it's great for the doctor to establish a baseline as to who you are. What are your current vital signs, your weight, your height, and then establish a relationship with that physician. And when you do have concerns that things that don't feel right with you, you're not running to the emergency room. You can call up your physician and make an appointment and get in within a few days. Sometimes they can get you in the day of your concern. And it's a smoother transition than going into the emergency room. You go directly to your physician, and that way they have all your records there. They know what your history is about. They know what medications you're taking, and it's right there in their office. And of course, a lot of the healthcare information of your record is now online, available to them at their fingertips. Also, you want to make sure you keep your own record. Track your own records when you're visiting your physician. When you walk out, we've talked about this in another episode as to what you need when you go to a doctor's appointment. How to get ready, how to prepare. Make sure you keep record. Walk in there with your questions ready. Come out with your information ready to be filed away, so that you can easily access it, or there's someone nearby, your loved ones, who can have access to those records if they need them. They know where to find them. So keep your own record tracking as well. What did the doctor diagnose you with, if there are any new diagnoses? What medications did they put you on? What tests are you going for? And why? Again, we've talked about this before. Always ask why. You want to know why you need to take medicines, why you need a certain test, so that maybe you can do things for your own health to get you off of those medications. You don't want to have to take certain medications forever if you don't have to. For example, blood pressure medicines. You just may need to control your lifestyle, change the way that you're currently eating, change your activity level, increase your activity level, things of that sort to get your blood pressure a little bit better controlled. And you won't know to do those things unless you ask why. Why am I taking this pill? You may not even realize it's a blood pressure pill. Always ask why and keep notes. Choosing a hospital. Again, now that you have the insurance, make sure that your insurance is covered at that hospital. Yes, believe it or not, there are some hospitals that will not take all insurances. So it's important that you know that you do your research up front. If you were to get sick and you have a loved one that is taking you to a hospital, you want to make sure that that hospital will cover your hospital stay bill. And there is a website called hospitalcompare.org. That too will also allow you to compare hospitals in your area, so that you can learn the quality of the care that is provided at that hospital. But again, you want to make sure that your insurance is covered at that particular hospital. Otherwise, if you fall ill, you're not critical, but you do need to be transported to a facility that is covered under your insurance. And who wants to go through that? So do your homework up front so that you know where to go in the event that you do have an illness that requires hospitalization. The last thing I want to talk about is outpatient testing. So, of course, when you go out to see your physician or you are hospitalized, then there are some follow-up testing that may need to be done, such as labs, x-rays, things of that sort. Even if you need an MRI occasionally, because of some concerns that you're having, a CT scan. Again, that is something else that you want to do your homework on. You want to make sure that your insurance is covered by whichever facility you decide to choose. Now, I know right now we're seeing several different commercials online or on TV that is telling us to go to this place or go to that place. Sometimes you may see your physician, and your physician may recommend a certain facility for you to use for your x-rays or for your labs. It is up to you to know which facility is covered by your insurance. So again, you have to do your homework. So just having insurance is not a card that you can just take anywhere and use like a credit card or a debit card. You need to make sure that that card is good at the facilities that you're going to. So do your homework. Make sure that your doctor takes the insurance that you have. If not, they'll tell you. Make sure that the hospital takes the insurance that you have. They may not tell you until after your stay, and then somebody is getting stuck with that bill, and it could be you. And make sure those outpatient tests, when you walk out of that doctor's office, they'll say, go to this place and have your labs drawn. Go to this place and have this x-ray done. It is up to you to make sure that that place is covered by your insurance. In the event that you receive treatment in a facility that is not covered by your insurance, a lot of these places offer financial support. So don't just think that it's a lost cause and now it'll go against your credit because you can't make the payments. Call these different places and try to work out a payment plan. Some of them will even reduce your bill to whatever agreement you come to. So don't take it as a lost cause. It's something that you can work with that facility with. And I think that's all we have for today. I hope that you come back for next Wednesday. We'll have more information for you. And again, our ebook is out there. So take a look at our ebook that's on Amazon. It's full of a lot of information where you can get a lot of free resources, where you can use your insurance card, and anything more that you may need. What the health fairs are about, what you can get out of a health fair. We have one coming up here in monthly. So I want you to just continue to follow my blogs, follow my YouTube channel. MyBloomingHealth.com is the website, and I look forward to continue to talking to you. Take care. Have a great evening.